All right. Hello and welcome everyone. I think we've had a few minutes to get everybody in the room, and I think we can get started. We want to, thank everybody for coming and for their time this morning, and also thank you to our host for providing this forum for us to present on some early findings on the research looking at COVID-19 and the impact on student well-being. So I'm going to start by introducing my colleagues. We have Gwen Schaefer, a Senior Program Manager at the Institute of International Education; Ashley Kong, a Senior Program Advisor at the Ministry of Municipal Affairs and Housing in Ontario Public Service; Josh Henson, Director of Mission and Ministry at the Salvation Army School for Officer Training; and myself, Amy Peterson, Project Manager of Clinical COVID Projects at UCARE. We are all master's degree candidates at the American University School for International Service. And one of the aspects of this program is it allows master's candidates to do a practicum project, which allows for working with an external client as well as a professor at the university to really develop and scope and conduct a project within a semester term that has both academic and professional application. We all joined the Education in Emergencies practicum offered by Dr. Ali Krupar of Save the Children and American University, and we're able to work with the Converge working group on our practicum project. And this is a group of social scientists and practitioners who are working to collaborate and share research and insights during the COVID pandemic. We worked with the educational group of that working group, which is supported by the Global Alliance for Disaster Risk Reduction and Resilience in the Education Sector, or GADRES. Specifically, we worked with some of the leaders in this working group, including Marla Petal, co-leader of the working group from Save the Children and GADRES, as well as the co-leaders of the sub-working group that's really focused on well-being. That's Dr. Rita Burke of the University of Southern California and Sarah Fuller, an education consultant with COVID presents what Save the Children identifies as the largest educational emergency of our lives. The impact of COVID on education and on children is multifaceted and will continue long into the future. We were not hoping to identify all of the impacts in this very large multidimensional. We wanted to focus really looking at the impact and interventions that are directly related to student well-being, and also to provide actionable research to inform interventions and to support the development of practice-based evidence. So to do that, we really honed in on two research questions. One, really taking a lay of the land approach and looking at what research is being done on this topic, looking across educational level, and also to get as diverse an international perspective as possible by looking at across all country income. Additionally, we wanted to identify key early findings and common themes in understanding student well-being, and really not just the impact, but also interventions that have been implemented during the COVID pandemic. In doing this, we identified key impacts on several dimensions of well-being, some cross-cutting themes for practitioner consideration, practical applications for programming, and recommendations for future research. To do this project, we conducted a literature review from September to October of this year. We looked at peer-reviewed literature and understanding the constraints of publishing in peer-reviewed journals during a pandemic. We also relied on gray literature. We divided our research effort to ensure we were getting a diverse perspective as possible at looking at all country income levels. For this project, we produced a literature tracker, which has all of the resources we identified in this project, an annotated bibliography, and a literature review, which are more from an academic lens, which we then use to kind of synthesize into a more practitioner-focused document that is a research into action brief, which follows the GADRES template, and we will be working with that team to do a peer review and hopefully have that published in the next year to provide practitioners with hopefully an action-oriented document that they can use. I will hand it off to Josh to begin to discuss some of our findings in more detail.
When we began the research, Well-being was one of the key terms we identified. And starting off, we thought that we might need to define well-being. When we began to research how well-being was being defined, we found several definitions. And instead of adding our own definition, we compared different definitions of well-being against one another to ask questions like, what are the key areas of overlap? So we went through 12 different conceptualizations of well-being and then mapped that overlap. You can see here on the screen some of the places that we went to see how are these folks defining well-being, and then what are those places? And these are the places we found those conceptualizations of well-being. Many of these definitions highlighted different areas of well-being to consider. These conceptualizations commonly identified domains or dimensions of well-being, and then we looked at which ones were present in multiple different conceptualizations of well-being. Additionally, we looked at which ones were brought up most often in the literature as being impacted by the pandemic. Here is an example of one of the conceptualizations that we found and the way that it also shows how these different dimensions interact with one another. So you can see on the side of the screen, they broke it down in health and safety, education and school life, and then child activities and life satisfaction, and then how that also interacted with the environment that the children were in, and then also the policies that were implemented, how those would also impact the environment and also have a direct impact on student well-being. This next one shows it from a different perspective with those dimensions there in the middle of the circle. And then if you go one layer out from that, the way that children's activities, behaviors, and relationships play a factor in impacting those different areas of well-being. Then you go another layer out to see how the environment has an impact on children's activities, behaviors, relationships. And then finally, that last ring, the way that public policy trickles through that to get there to the center to impact these different dimensions of well-being. So as we went through the various definitions of well-being and mapped the overlap and compared articles about the impact of COVID-19 on student well-being, 4 dimensions or domains stood out. They were regularly included in the conceptualizations as well as the literature. Those were physical, mental, social, and household. And we will go through each of these dimensions one by one to show how each aspect of well-being was impacted. Overall, student well-being, we're probably aware that COVID-19 impacted student well-being. The question is how? And the research pointed at different impacts in each of these different dimensions, and we will start with the physical impacts. While children had a lower morbidity and mortality rate related to contracting the virus, the indirect impacts on physical health are profound and will have long-term effects. Some of the policies put in place to mitigate the spread of the virus had impacts on physical well-being of students, such as school closures, which meant for many students there was a loss of access to meals provided at schools. There's also less physical activity as many children get their physical activity at school. And physical activity, diet, and sleep regulation have been associated with being in school. Children also, when schools were closed, missed out on basic health screening services that take place in a school setting. Throughout the pandemic, there was also tremendous stress on the healthcare system, which caused disruption to care. A study in Portugal showed children missed 21.6% of vaccinations, 54.2% of outpatient services were postponed. There's also reduced access to health systems. In a report from Save the Children, 89% of respondents said the pandemic has impacted their access to healthcare. And also, additionally, there was a reluctance to access healthcare. A survey in the US showed more than a third of parents with children under 6 reported delaying healthcare visits. When you consider the pandemic, you also need to consider the economic impacts, which led to increased food insecurity. You also saw decreased nutrition. In a Save the Children survey, 62% of respondents said they were having difficulty providing proper nutrition for their families. When you take these different health impacts and stack them on top of each other, there will certainly be long-term health impacts based on these things. This time I'll turn it back over to Amy for the impacts to mental and social well-being.
Understanding the mental and social health impacts of COVID, it's important to start with the understanding that the school environment and routine provided by school, the school continuity and school connectedness are within the scholarship. It's very clear these have an important role in the mental and social health of children. COVID, we've seen changes to the mental health and psychosocial supports that students normally receive in their everyday school setting. So the loss of those services and very often abrupt stoppages of those services, as well as unclear expectations around how they may continue in a physically distant or remote environment, created mental and social health impacts for children and families. Additionally, we see in the literature new health challenges that have arisen due to COVID-19. And that includes a loss of socialization due to a need to confine or lockdowns and quarantines. General concern about the state of the world during a pandemic. Additionally, specific concerns about family vulnerabilities or how to continue to engage with their education in a remote environment, unclear expectations around educational attainment during the COVID pandemic. All of these things created increased stress and anxiety for children. It's important to note that within the scholarship we reviewed, this has been identified as a concerning impact across age ranges in children and adolescents, as well as really globally around the world. This was identified as a concern. Additionally, we have the potential for severe mental health. In a study in Bangladesh of over 400 families with a 5 to 15-year-old in the household, over 7% identified severe mental health disruptions, including depression, anxiety, and sleep disruption. Additionally, suicide is a concern in the United States. The CDC identified a 30% increase in suicide attempts in adolescents from 2019 to 2020, looking at emergency room visits. A qualitative study in Ireland, where within a school that did have a student suicide, identified the difficulty in supporting the students and mitigating the potential for suicide contagion because of the lack of that school environment and that school context. So it's clear within the scholarship we reviewed that mental and social impacts of COVID are robust and need continued exploration and support for children. Hand it off to Gwen to look at some other impacts.
All right. So in addition to those impacts outlined by Josh and Amy, the literature also demonstrates that the broader family and household environment can have a significant impact on child well-being. So here I'm going to highlight several key areas of concern. So first, practitioners and academics alike have worried that lockdowns would lead to increases in both child abuse and domestic violence. For child abuse, this was largely based on previous research demonstrating that familial stress leads to a greater likelihood of abuse. The linkage between child abuse and COVID is important to understand because the evidence shows that child abuse, whether emotional, physical, and/or sexual in nature, can have a negative impact on the physical and mental well-being of a child at the time of the abuse, and it is linked to continued adverse health outcomes over time, such as depression, risky sexual behavior, drug alcohol abuse, suicide, and diminished educational and employment outcomes. But for domestic violence, which we broadly define here as interpersonal violence and intimate partner violence, the literature also assumes, based on previously identified domestic violence patterns, that COVID would bring an increase in domestic violence due to isolation, uncertainty, economic stress, and unemployment associated with the pandemic. So what did we find in our research? So for child abuse, the limited available evidence shows reporting decreases in some places like the US, where schools are the main mechanism for child abuse reporting. However, in Uganda and South Africa, we saw that the national abuse hotlines saw dramatic surges in calls at the beginning of the pandemic. For domestic violence, we did not identify any comprehensive studies that examined national trends in domestic violence related to COVID, but findings from the initial lockdowns of March 2020 shows that calls to domestic violence crisis call lines did increase by 25% or more in France, Cyprus, Singapore, and Argentina. So next we examine the loss of caregivers. As of November 2021, over 5 million individuals have lost their lives due to COVID, and over 1 million children are estimated to have lost at least one primary caregiver. So caregivers here could be parents of children custodial grandparents, and many other forms of primary and secondary caregivers. So research clearly demonstrates that there is an adverse effect on children's well-being when they lose caregivers. So with their deaths, children can face physical and/or psychosocial harm, such as lack of consistent access to food, exploitation by other family members, or even orphanhood. So this was seen in other public health emergencies like HIV/AIDS and Ebola in particular. So given that there are huge swaths of the world where children live in multi-generational homes with older caregivers who are more susceptible to COVID, further research is needed to understand this potentially vast impact on children. So in the meantime, though, we can look to best practices from other public health crises to better understand effective economic and psychosocial support mechanisms. And finally, we looked at financial insecurity. So as of October 2021, the global labor market has not recovered from the pandemic, and job losses are concentrated in lower income and lower middle income countries, as well as among young people and women. So losses in household income put children at risk of poverty. Estimates show that 42 to 66 million children now live in extreme poverty due to COVID. So this has an impact on child well-being as economic instability, job loss, and difficult living conditions are all shown to negatively influence the physical and mental health outcomes for children. Financial insecurity can also be tied to school dropout rates. There are relevant findings from the 2013 to 16 Ebola pandemic in Guinea and Sierra Leone, which showed high post-pandemic dropout rates among the poorest households, while higher income house retention rates remained stable. So in that scenario, there was much economic instability and high student loss of caregivers, forcing them into income generating activities to support themselves and their families, rather than returning to school once those schools reopened. This then puts students at a higher risk of sustained poverty in their lifetime. So again, there is kind of minimal research on this front, but we can look to findings from Ebola and similar public health emergencies to better understand the financial burdens placed on children and their families, as well as potential interventions. And so with that, I'll turn it over to my colleague, Ashley, to discuss equity concerns.
So as we continued to explore the literature, we came across another area worthy of discussion: the negative impacts of COVID-19 on the well-being of students who are already marginalized in society. So how can the exacerbation of existing inequalities sustain the gaps between advantaged and disadvantaged students, educational and livelihood outcomes during the pandemic and beyond? So learning loss is defined as a deterioration in knowledge that is forgotten over time, and the opportunity cost of learning loss is the potential loss of lifetime earnings. And although all students across the globe have faced learning loss as a result of the pandemic, students in low and middle income countries face more severe impacts. Regardless of country income level across the literature, vulnerable populations such as students living in low and middle income countries face disproportionate educational impacts and equity concerns. This is due in part to lack of critical health and education infrastructure in comparison to high income countries. And the prevalence of health and education infrastructures that lack the adequate resources and capabilities to respond to the shocks posed by the pandemic contribute to high levels of learning loss for students living in low and middle income countries, which in turn impact their future educational and economic outcomes. So the term vulnerability has been defined across the literature in various ways, but for the purposes of this literature review, vulnerable children are classified based on their socioeconomic status, special needs, gender, and access barriers. And conversations surrounding the well-being of students must include how to best support students that are classified as disabled, which surpass physical disabilities, but also extend into the invisible disabilities, which include emotional, development, or behavioral needs. And across the literature, we also found a disturbing consensus that exposed the potential that the pandemic has posed in stopping or reversing the recent advances in gender equity in education, which warrants another area for future discussion: the well-being of young girls and women. Another group of vulnerable students are immigrant and ELL, so English language learner students. For students of color and ELL learners, remote learning has proven itself to be difficult. Coupled with remote learning, intersecting disadvantages of socioeconomic status, access barriers have also presented this group of students with the need to support their younger siblings in navigating remote learning, serve as an interpreter for their families, and have resulted in them bearing the financial burdens and supporting their families by seeking employment on top of their studies. And lastly, as we have become more technologically reliant, it is critical to consider the questions surrounding the challenges posed for students in urban poor households or poor rural households and their ability to access their educational content. So what are the implications of digital inequities on students' educational outcomes? Digital inequities and the gaps between disadvantaged and advantaged students have been present across the research, revealing that urban households in Western nations have greater accessibility to electricity, the internet, and smartphones. Meanwhile, rural communities are plagued with a lack of basic living resources and underdeveloped educational infrastructures, resulting in students having to rely on unconventional modes in accessing their remote learning content. This includes things such as WhatsApp groups or SMS. So moving forward in the next section, I will pass the floor to Amy to discuss the positive experiences learned from the pandemic.
Of concerning impacts, it is important to note some of those positive experiences as well. So the use of the remote learning environment really worked for some students. It suited some students' learning styles. Not having to be in the educational environment reduced social anxiety for some children, with reduced exposure to bullying or microaggressions in the school. Additionally, for students who needed to support additional household or family needs, the flexibility provided by remote learning opportunities allowed those children to continue their education where they may have had to drop out in other circumstances. Additionally, something for longer term study and investigation is the development of the coping and resiliency skills in this COVID affected generation of students is an important area for continued research. As we've discussed a number of impacts, we want to move into discussing some early findings and some recommendations. And that really begins with these cross-cutting themes that we have identified through the literature. And that it starts with contextually and culturally relevant approaches are necessary. There is no one size fits all. The consideration of vulnerable populations must happen at the beginning and throughout to ensure inclusive and equitable. Balancing the needs and considering the voices of all stakeholders is sometimes potentially daunting, but it is important for sustainable. And finally, this is an evolving situation, as we are all well aware, I'm sure. It requires more time, focused research on student well-being, and cross-sectoral and cross-jurisdictional collaboration. These cross-cutting themes that we have identified here really inform the recommendations which we have, which are organized based on school, family, community, and policy recommendations. In starting with the school recommendations, we start with the premise that each school is its own ecosystem and each student has their own specific needs, which means situationally appropriate education is required. And that includes, age and context appropriate tools for mitigating the virus. Additionally, accessible and sufficient training on new tools, new methods, any new assessments to engage students and empower them to continue that engagement with their own education. In Uganda in 2018, the use of peer support groups was found to support children during the West Nile pandemic, which required quarantining. This peer support groups were also used in Egypt and Australia and the United States during COVID to mitigate some of the loss of socialization and the impact to mental and social health that had. And finally, continuing to build that relationship and maintain communication with students is incredibly important in a time of changing educational environment. In order to do the student supports, you need the educator support. And that starts with a collaborative environment in the school, which supports reflection and sharing, allows for the adaptation of the curriculum based on changing circumstances and based on both the educator and the student needs. And training and professional development is key to support not only utilizing new tools, but giving teachers and educators the confidence to deploy new systems and empower students to also engage with those new techniques. Building and maintaining relationships, ensuring teachers and educators are prepared to do that in the changing circumstances that have come with COVID. And finally, when we're talking about using technology, it's important that educators have the data security literacy to ensure that they're protecting children's privacy using.
Okay, so while those school-based interventions are crucial, they must also be tied to family and community support. So across all income levels and a variety of contexts, the literature shows that the inclusion of caregivers in student learning is essential for both the attainment of learning outcomes as well as the support of their overall well-being. Yet, we saw that the marginalized families that often need the most support are the ones that have been most disconnected from teacher or school communication. So therefore, focusing on those families and providing them with information and resources to support their children's learning needs is crucial. And the literature also notes that small measures like sending an SMS to explain the homework or school expectations can have a big impact on this front. So small interventions can really go a long way, is the main takeaway. However, what's clear from the pandemic is that schools and caregivers alone cannot support the well-being needs of children. With community resilience, community members and organizations come together to distribute social capital and resources to meet the needs of the most vulnerable members of the community. So there's several great examples of how this is being employed across different contexts in Africa to support the well-being of children, both within the context of COVID and more broadly. So for example, in Nigeria, the government forged new partnerships with NGOs to provide remote learning support for children in marginalized and geographically remote areas. So areas that they really couldn't reach quite as well. So they created these new partnerships with community NGOs. And in Kenya, the country's longstanding community health volunteer model is now being utilized specifically to support the continuity of learning for girls and to create new communities of practice. And then finally, we must consider the role of gender. So globally, there are gender-based differences in how children's well-being and access to learning are impacted by the pandemic. Approaches must be contextually relevant and designed with the understanding that girls and boys face gendered educational disadvantages in their own way, meaning there are no cross-cutting assumptions that can be made across contexts to understand the intersection between gender and education. While further research into successful interventions is still needed, the literature does have several key recommendations, such as establishing community-centered and family-oriented communication and mobilization campaigns, support girls' return to school after lockdowns, creating gender-sensitive and flexible catch-up education programs, providing school and community counselors for reporting abuse and providing those wraparound social support services, and finally, removing policies that discriminate against pregnant girls and young mothers. So with that, I'll turn it over to my colleague, Ashley, to talk more about policy recommendations.
So to support the student, school, family, and community recommendations mentioned by my colleagues, the key takeaway we hope to push for the future of education policies is to focus greater efforts on enforcing inclusion, redressing all forms of inequities by providing technical, emotional, mental, and operational support, and overall prioritizing the educational needs of all children, regardless of socioeconomic status, gender, disability, or access barriers. Moving forward, the first step in redressing digital inequities requires powerful infrastructures, which start with public and private investments. Both innovative and low-cost approaches should be considered to increase digital content to access through multiple delivery channels such as the radio or WhatsApp, with the goal of ensuring equitable access to the internet, as the reliance and persistent use of remote learning will stay in our foreseeable future in a post-pandemic world. And lastly, policies in low and middle income countries should aim to balance the policy priorities of preventing economic collapse in already susceptible classified countries, while also promoting and advancing public health measures. Community-based interventions should be integrated into low and middle income countries' policy frameworks, providing diverse solutions that is different from high income countries. It is crucial that low and middle income country governments aim to incorporate local epidemiological, socioeconomic, and cultural contexts, while also aiming to redress and support young women and girls during the pandemic. Overall, to conclude our research findings, we hope this presentation has been insightful and has provided you with a greater understanding and how the pandemic has transformed our world, and with it, the opportunity to proactively and positively restructure and reimagine our education system. Our research has shown that there are significant opportunities for the continued exploration of the individual, family, community, and governmental influence on the student well-being due to the pandemic and beyond. I'll now pass the floor over to Amy to conclude with the research areas we have identified that warrant further exploration.
We have identified a number of impacts, a number of early findings and opportunities. It is essential to note that there is still a need for empirical evidence, both on the impacts that we have identified, as well as assessments on the interventions that have been implemented to support student well-being during the pandemic. There is significant opportunity to continue to explore child well-being during COVID, and that includes the outcomes based on the dimensions of well-being we've discussed. Additionally, the understanding the disparate impacts for marginalized and vulnerable children, both within and across communities, and identifying opportunities to continue to explore and leverage technology to meet the needs of students, not just educational attainment goals, but to really prioritize student well-being. And by investing in this research, we can develop practice-based evidence to support not just child well-being during COVID-19, but to plan and prepare for the next pandemic or the next public health crisis, and to support education in emergency best practices more broadly. And with that, we thank you for your time and your attention. We thank once more all of the technical support and our hosts for providing us this forum, and our advisors on this project, Marla and Rita and Sarah and Ali, for supporting us and providing us this forum. And we are happy to answer any questions you have. You can use the chat or the QA box. If you would like to raise your hand, we'll be able to unmute you and allow you to answer a question. So I will stop sharing my screen so that we can have a discussion, and hopefully we have some questions to continue the conversation.
We have a couple already in the chat box.
Yeah, so I see the first question here, Josh and I can take this, regarding the digital divide in low and middle income countries. So yes, we did look at the digital divide in low to middle income countries, but the problem is that Gwen and I were having issues with finding a lot of the research because it is scarce. So just based on what we found, I found that in Uganda, about 80% of school-age children live in rural areas, and they are utilizing unconventional modes that I had mentioned, such as the radio rather than the television or internet. In Kenya, only 22% of students had access to digital content. So they've used a lot of different approaches in terms of unconventional methods, again, using the radio or SMS. I found that a lot of the findings here display that students are very resilient in finding unconventional modes. When you don't have access to the internet and you still need to access your digital content, they find ways to work around it. And Gwen has also noted that students have utilized WhatsApp groups. And I know Josh has also done some research on digital divide on a broader scale, so I can pass the floor to him to see if he has anything else to add on.
Yeah, the initial research was looking at school closure as a policy and when to do that, and taking the digital divide into account when considering when to do that. As we have already, Amy touched on this as well as others, contextualization is so important in making those policies and not thinking what worked. And that, well, if you have that digital divide, it may not work in the same way, as well as when to reopen schools, how to do that safely with taking that in a context and saying there is a lot of truth to, there's a lot of limited as far as how effective were things like the radio in the literature. But the real thing that came through was, okay, how do we prepare for the next thing? We've got to try to find ways to erase that digital divide, to kind of even the playing field, to push for infrastructure, to provide those resources where the next time around or in the future, that becomes less and less of a concern, because it certainly is a huge concern across the board in dealing with the pandemic.
The second question, to build off of that, I think we can point this one to Amy. So the second question asks about other positive outcomes and resilience. Like, what exactly did we find in our research for the section?
Yeah, so there's, not a lot of empirical findings, obviously, at this state, but there are opportunities, I think, which we found in the literature around how have children been able to take the pandemic experience, whether that's more time with family or more flexible learning or meeting additional family needs while continuing their education. How can we take those aspects of flexibility to ensure that children are continuing to gain resilience and coping skills through this? I think there's a fertile ground for additional research in this area because we do see, very concerning mental health impacts, but we also hope to find opportunities to engage with, building more resilience, building stress mechanisms, maintaining stress and handling stress mechanisms in children as well.
I see a follow-up question here from Sarah. So Sarah asked the team,
Wait,
could you
Ashley, but sorry to interrupt you. I think Mona I saw Mona raise her hands and see if you had a follow-up question. Mona, feel free to hop on the camera.
Okay, can you hear me?
Yes, we can.
Yeah, good. I was doing research in northern Syria, and resilience came up as an issue. Yes, it has been positively impacted, and therefore I was asking. However, there is another follow-up question here, and that is in Syria, we found out that something that was very positively impacted was the perception of the whole community towards the concept of learning. For the very first time, because I am from the MENA region and I know the concept and the attitudes that are prevalent in communities, especially in rural areas, for the very first time after COVID, families started to realize that learning does not equate going to school and that it is possible to continue learning through other modes other than going to school. And this, let's say, disruption in previous perception helped very much in continuing other modes of learning, or to broaden the whole idea of learning and to put it in its correct, in a better or a wider context, let's say. Did you find out something of that sort?
I think that is a great a point to mention as well. I think that is definitely something that is at an anecdotal level where we see more appreciation for teachers and more appreciation for what education can provide in different forums. I think one of the, expanding viewpoints in that is how do we use technology that meets the needs of different communities. So some of the things like, let's use a WhatsApp group. Or can we provide free, data for communities so they can use their cell phones to access those digital tools, and having, innovation and unique ways to continue to engage with education in a broader sense is certainly an area which we hope can be expanded through the post-pandemic period.
Thank you.
Thank you for attending and the comment. That experience in northern Syria is really interesting.
Okay, so we have one question in the Q&A from Sarah. So Sarah asked, could you share any more about any differences you saw among regions or countries? So I think the team, we can kind of popcorn jump on this. Amy and Josh took care of the research in high income countries. Gwen looked at low income countries and I looked at low and middle income countries. So
I can start with the lower income countries that didn't focus on. I think the largest challenge, quite honestly, was just finding available literature, particularly in the peer-reviewed space. I mean, this is not an issue that is relegated to COVID. This is, a broader issue within academia. So first, finding peer-reviewed literature was very difficult in those contexts, as well as even gray literature that was really up to speed on what was happening with COVID. So what I did find, though, was there's a huge emphasis on digital divide, like Ashley already talked about. And that was where we saw a lot of disconnect in some communities with the inclusion of parents and households, particularly in the most marginalized communities, and of course, the most adverse impacts on girls' educational access and attainment. So those are some of the big themes that I saw in those contexts.
So similar to Gwen, I also had some trouble coming across research, and luckily the team, we had a literature tracker. So if we ever came across the same article, we were able to either tell each other, hey, don't do anything else because we've already done this. Or if we've come across articles that were useful for someone else, we've been able to ping each other. So in my research, I found that there was a really strong emphasis on non-pharmacological or community-based interventions. So this was a strong emphasis on straying away from high-income countries interventions and focusing on engaging with local communities, local partners, with students themselves and teachers. And for what I found in my research, there was a strong emphasis on just ensuring that local governments are ensuring that they're encapsulating like local cultural contexts, ensuring that they're taking account the socioeconomic status that is, pertaining to this individual region. That was pretty much mostly what I found. And there was also very strong emphasis as well on ensuring that young girls and women are supported.
In some of the physical aspects in higher income countries, there was more of an emphasis on the physical activity that students get at schools, as opposed to a lot of the information about the physical impacts focus on not getting the nutrition that can be provided through meals at school. So those were some of the differences as far as focus on one, weight gain. Also, some of the high income countries focus a lot more on the activities. What are they doing now? Their days look a lot more, students' days look a lot more like they do on the weekend. Their time on screens is way up, those kind of things. So those were some of the differences on the physical side.
I would just like to call attention to Marla's comment in the chat. If you would like information about publication or being able to access some of the resources we produced, there is a link there and an email address you can send a request to and make sure that you get anything that comes out from this. We do hope that the research into action brief will go through peer review and be published next year and get that into hands of practitioners as quickly as we can. I do know that Marla had another question in the chat and wanting to just a little bit more information about the range of peer support approaches. And so there were a number of, very micro, small scale to kind of larger peer support approaches that were used kind of in terms of some of the research in previous public health crisis in Uganda. They had fairly robust child-led peer support groups that allowed for children to kind of take ownership of some of those, lack of socialization concerns. In the United States, we saw a kind of bubbles, if you're familiar with that, where you kind of create a small group where you continue to take safe practices, but have kind of a community which you can continue to socialize with and mitigate some of the loss of that. One of the things we identified was the ability to allow the peer support groups to be child-led so that they can engage and continue to kind of have some ownership in that level when there's, the world they don't have a lot of control over. So that was one of the aspects we identified in the peer support groups, which supported that mitigation of the from the socialization.
And just to build upon what Amy said, something that I saw as well was to kind of help foster those peer support networks is creating those child-friendly spaces as well. Particularly, I saw this pop up in literature that was more focused on education and emergencies of places like refugee camps, et cetera, where that had been a really core part of psychosocial programming. And practitioners in that space really had to, adapt those child-friendly spaces so they were both COVID space, but recognize that there's a really strong need through whether it be extracurricular activities or just general activities to allow children to be able to socialize in a safe manner, and again, kind of create those peer support networks.
I am not seeing any more questions. So I'll give everybody another second to consider if they have any last thoughts. They have any questions or last thoughts they'd like to share. It looks like we might all be done for a December morning. I want to just appreciate again all of your attendance. Really great to have a discussion on this topic, and we hope that you all will kind of follow along and hopefully have access to these documents, and that they will provide benefit and some insights into your practice and research going forward. And thank you, Ms. Eunice, for attending. We appreciate. I appreciate seeing people here who I don't know. You know, it definitely adds some excitement to be able to share this broadly.
Oh,
Go
we
ahead,
got
Mona.
Mona.
Is there a link to the publication?
We do not have a time frame at the moment. We have published our, we have produced our final drafts. Those are going through peer review, and it is kind of end of year time. We're hoping that those will be available early next year. But we can also discuss with our team around when we could make some of the other resources, including like the literature tracker, more broadly available. So do send an email out to that email, and we've got yours. Excellent. We'll collect that and make sure that you're looped into anything that comes.
Whenever you want to publish it on INE, just send me an email, because I am an active member and a member of the distance education reference group. It can be published there easily.
Thank you so much. That, as many people as we can reach, that is very exciting. So thank you for that. And thank you for Sarah and Hari for the words as well. Have a fantastic rest of your day, even if that's quite short where you are, or me, I'm very early in the morning. And enjoy the end of the year. Thank you, and have a great rest of your week.
Thank you,
Thank
everyone.
you, everyone.